I am Dr Mainak Chatterjee. I am consultant cardiologist in Peerless Hospital, Kolkata. I have special interest in treating heart failure patients. Today I will discuss about heart failure. So what is heart failure? Heart failure is a disease where your heart is weak. The primary insult to the heart muscles weakens the heart, and there is poor function of the left ventricle, and the weak heart cannot supply essential nutrients like oxygen to different vital organs of the body. What are the symptoms of heart failure? The patients usually report to us with complaints of easy fatigability. They have experienced shortness of breath during walking or doing normal activities like climbing upstairs or walking uphill. Even at advanced stages, they have these symptoms even at rest or doing ordinary activities like taking bath also. They experience their own heartbeat, which is known as palpitations, and they experience palpitations and irregular heartbeat during their activities or even at rest also. They also have symptoms of volume overload, where we find the swelling of feet, there is pleural effusion or even distension of the abdomen. Another important component in this aspect is arrhythmias. What is an irregular heartbeat? And they experience atrial fibrillation or ventricular tachycardias, which can be life-threatening to these patients also. What are the causes of heart failure? The first, primary and foremost cause in this aspect is coronary artery disease or an acute heart attack. Different defects of valve also causes symptoms of heart failure. We experience these symptoms of heart failure in patients who have diabetes, hypertension, thyroid disorder or kidney disease also. Excess intake of alcohol also damages your heart, and also deficiency of vitamins like particularly B1 also causes heart failure. Peerless Hospital has a dedicated heart failure clinic where we identify the causes of heart failure and also we treat them accordingly. So coming to the management, we give them a detailed analysis of the treatment, which include dietary modifications like salt and fluid restriction. Regarding the medicines, we have our Fantastic Four, which are the cornerstone of heart failure management, like beta blockers, ARNI, newer anti-diabetic drugs like empagliflozin, dapagliflozin, and mineralocorticoid receptor antagonist. This group of drugs not only decrease the symptoms but also prevents the further progression of the damage to the heart. And around 80% of the patients are stable or have the normal lifestyle with this group of drugs only. Some patients require further advanced management, where we find different changes in the ECG like left ventricular bundle branch. A small subset of patients who does not recover with the medical management requires further advanced type of treatment, and this advanced type of treatment includes modified pacemakers like CRT and ICD. What is CRT? It is a cardiac resynchronization therapy, and particularly if a patient have LBBB in the ECG, this CRT has improved survival and also improved the heart function in these patients. ICDs are beneficial in the patients with poor LV function with history of ventricular tachycardias, ventricular fibrillation, or in the subset of patients who have come out of a life-threatening cardiac arrest situation. This group of patients require multidisciplinary approach, and in Peerless Hospital we have a very good ICU setup and doctors from different multi-specialties, where we work as a team to take care of this subset of patients. So when should you consult a cardiologist? If you have symptoms of heart failure, definitely you are always welcome. But if a patient has got a family history of heart disease, he is a diabetic, chronic smoker, he is hypertensive or have thyroid disorder, their heart needs to be evaluated at an earlier stage so that we can treat these risk factors to prevent further development of heart failure.
Peerless Hospital, ভরসা রাখুন, সুস্থ থাকুন।